Hey Bernard, how you doing, bud?
I'm good. How you doing, boss?
I'm good. I'm good, man. Thanks for joining us.
My pleasure.
How's everything going today? Busy
Good,
as
good.
always?
Busy as always, sir. Yes, sir.
All right, awesome. Well, while everyone logs in, I'll just do a brief introduction about you.
Okay.
For those of you who don't know Dr. Ashby, he's a vascular cardiologist by training. He is CEO of Comprehensive Vascular Care. He's also an MSNBC Special Correspondent. He's been covering COVID and the presidential transition. His background is very impressive. He was born and raised here in South Florida, medical school at Cornell. He did health policy at Princeton, internship and residency at Columbia, where we actually overlapped. Then he did his cardiology training at GW and his postdoctoral fellowship at Johns Hopkins. So not too bad. Great background, a lot of experience in this, and has been interviewed a lot on this very important topic. We're going to be discussing Biden's COVID task force and what are the key elements that they have to tackle over the next several months. So again, welcome, Bernard, and thanks for joining us.
Thanks for having me. Thanks for having me, Ricardo. Pleasure to be here.
Absolutely. So I guess we'll start just very general. I mean, how tough of a job does Biden and his administration have in the next 3 to 6 months?
Uh, can I keep it real with you?
Yeah, absolutely.
I mean, so right now it's a shit show.
Perfect.
They're inheriting a complete disaster from the outgoing administration. As you can see with the current surge that's happening, we're breaking records every day. We had 2,000 plus deaths yesterday. Um, that's insane, given the fact that we haven't even hit Thanksgiving yet. And by all accounts, that's going to further accelerate the surge, which is already doing, a vertical increase right now. That slope looks crazy. And so by the time the Biden administration takes over on January 20th, they have a shit ton of work to do. And unfortunately, the current administration is pretty much checked out. And in addition to that, they're stonewalling them on access to the information. So it's not good.
So that's a whole nother topic that I was going to save for later, but you kind of brought it up. I mean, what kind of work can Biden and his task force do before January 20th? Is there any way to get a head start, or are they just in neutral until January 20th?
So there's plenty that they can do. I mean, one is by uh, t tailoring their messaging, which they've done. All of their 13 task force members or transition team members have been out front in the media, kind of informing the public about what to do with the upcoming Thanksgiving holiday and the holiday season, informing people on the evidence-based guidelines behind preventing further transmission. And so that's incredibly important. But even behind the scenes, they can reach out directly to folks at the CDC, folks at the NIH, folks at the FDA, folks like someone like Fauci, for example. It's nothing to pick up a phone or meet with him to get the information that he knows about the vaccine development, which he's directly involved with, particularly the Moderna vaccine, which the NIAID is overseeing right now. So there's again a ton that they can do, but they're limited. One area that they're limited in is a distribution plan. That really needs communication with the current administration. But they can have their plans in place and then try to extract as much information as possible. So again, they can do a lot, but they're extremely handicapped at this point.
Got you. And so, I mean, who's on the committee, and just give us maybe a little background. Who are these experts and how well qualified are they to be on Biden's COVID task force?
So the task force is comprised of 13 members. Three of them are the co-chairs. I guess I'll start with the co-chairs and let me reference my notes here. Give me one second. You have Dr. Vivek Murthy. He's a former Surgeon General in the Obama administration. He's very impressive. His background is in public health and health policy. Let me just see here. yeah, public health and health policy, and he's worked with Ebola, Zika, and dealt with the Flint water crisis. You also have David Kessler. He's the other co-chair, and he's professor of pediatrics and epidemiology. He used to lead the FDA back in the 90s, so he has a ton of government experience. And last but not least, you have Dr. Marcella Nunez Smith, who's also a co-chair, and her background is in internal medicine and public health, but particularly in health equity and dealing with marginalized populations. The rest of the members are a mix of different backgrounds. You have an ER doctor, you have a few infectious disease doctors, and you have a couple of folks with public health backgrounds as well. So I think it's a good mix. They're all physicians or scientists. I do think they can benefit from other healthcare professionals and other folks who deal with health-related issues. So nurses might be helpful. Pharmacists might be helpful. So hopefully they add some more to the mix once they go into place after January 20th.
Now, they haven't been very specific yet, obviously, about what their action plan is. But if you were in charge of the task force, what would be your top 5 priorities going into, January 20th?
Okay, well, I'm gonna have to wing it.
Absolutely.
But my top priority right now, given that we're in a crazy surge, would be to get that under control right now. And that would be to target specific communities that have areas where hospitals are being overwhelmed and they're at capacity, and to institute but stay-at-home orders, basically. Now, I think people get confused when I mention that, the term lockdown, and no one wants a lockdown. I mean, I don't want a lockdown, and I don't think anybody in America wants lockdowns. But when you have people dying by the thousands, you have to break that transmission immediately. So that would be at the top of my list, to immediately get this current surge under control. Next is testing. This is something that I've been screaming at the top of my lungs for months. And that's something that the current administration really has failed to come through on. And what I mean by testing is not just diagnostic testing, but screening testing and rapid testing as well. So obviously, diagnostic testing is important for symptomatic individuals, but that's just a fraction of the population. Surveillance testing or screening testing is incredibly important. We need to give everyone access to cheap, probably free testing in their homes. Send everybody testing kits, or at least give them access to rapid testing centers where they can test themselves, or go to a center and get tested pretty quickly without standing in line for hours to get a test. And so that needs to be ramped up immediately, because frequent, rapid, cheap testing is basically our X-ray vision for the virus. So that's very important. Next is as it pertains to vaccines. Now, with the vaccines, it's important to realize that there's a couple of issues there, not the least of which is folks' trust in the vaccines. That trust has declined precipitously from the beginning of the pandemic to now. Roughly 75% of the population said they would get the vaccine or would be likely to get the vaccine, and now it's at 50%. But if you look at minority populations, particularly Black populations, that's now at a third. There was a recent study done in LA looking at a community, I believe was Compton, where 90+% of the folks in that community, mostly Black, said they would not get the vaccine. And that's very concerning, because those folks are the ones that are at the highest risk. I mean, Black folks in particular have shouldered the burden of this virus, because of this pandemic, because we only account for 13% of the population, yet we account for a quarter of the deaths. So we're almost 100% overrepresented when it comes to the total of deaths that are occurring in the community. So being very aggressive about the public health messaging to those communities, and basically all the communities, but particularly vulnerable communities that have a resistance or a distrust of our healthcare system. That's incredibly important. But in addition to that, the distribution, and that's where I see a real concern where the EUA that's about to go into place for Pfizer and Moderna, once they get that emergency use authorization approved, their distribution plans should definitely include communities of color, but particularly using physicians like myself and other folks who have been advocates and have gained the trust of our community to oversee that. Because I guarantee you that even if they do provide the vaccines to certain communities, a lot of folks aren't going to go. But if you equip physicians who are community leaders and other community leaders that have gained the trust and have put the work in and have the relationships, that's very important to getting the vaccine to high risk communities. For example, I have a large, I should say large, growing cardiovascular practice. The majority of my patients are high risk. I've been fortunate that none of my patients have gotten the virus that were with me. I've gotten new patients who presented with the virus, and I've tested them and then managed them afterwards. But my patients have been basically under quarantine since the onset of the pandemic, and they need to live their lives, and they're dealing with issues like depression, for example. And so I need to figure out, how do I get access for my patients right now? The next thing that I would focus on is outpatient treatment. Now, that's an important point that's not being discussed enough. So I forget what company it was. I think it was Johnson & Johnson recently got approved for their antibody therapy, the monoclonal antibody therapy. Now, that is an outpatient treatment. I have no idea how to get access to that, for example. And other therapies like remdesivir, for example, which has actually had some pretty bad press lately because it's ineffective. That treatment should actually be an outpatient treatment. And so is the antibody treatment, because it actually deals with the virus itself. And so there should be programs set up in the outpatient setting that targets high-risk individuals who get the virus early, and treatment should be instituted within 48 hours. And there's really no programs to deal with that. Next is hospital capacity. And this is an issue that I've put on my back because we know that at the onset of the pandemic, a lot of folks died because certain hospitals were overwhelmed. Now, the case fatality rate has gone down because of a couple of reasons. One that everyone talks about is our improvement with the familiarity with the virus and our ability to treat it. We have new therapeutics, we have better methods. So for example, we're not intubating folks quickly. We have a much higher threshold. We're using high flow oxygen therapy. So that's critical. But what's not being talked about enough is the fact that certain hospitals got overwhelmed, while miles up the road, you had other hospitals that didn't have any patients, really. I mean, not any patients. They had patients, but they were incredibly slow. So like Elmhurst Hospital in New York, they couldn't handle the load of patients. Whereas in Manhattan, you had institutions like Cornell and Columbia where patients were, they had plenty of capacity, and the ERs were just waiting for patients, and no one was coming. And this is because of a systemic issue where hospitals don't want to deal with patients without insurance. They don't want to deal with patients with Medicaid. They don't want to deal with patients with insurance that doesn't reimburse well. So what they do is actually have contracts in place with these ambulance companies where they're actually expressly forbidden from taking patients to other hospitals. And so because of that, a lot of hospitals in urban centers, even rural communities, get overwhelmed, and there's no plan in place to redirect patients to other hospitals that have the capacity to deal with those patients. So that needs to be a national plan, and also a state plan, and obviously a local plan at the municipality level. So that's incredibly important. And then I think I'm at 5 now.
Yeah, you are.
Yeah. So in terms of the fifth point, the next step would be to essentially put permanent plans in place to deal with future pandemics, other emerging pathogens that are sure to happen. COVID-19 wasn't the first, and it damn sure won't be the last, especially with the globalization that's occurring now. And so we need to have plans in place. But also, we have current epidemics that aren't being treated well, such as HIV. That's something that is appalling, because we have technology in place right now where we could do rapid testing for HIV, and we're not doing that. I mean, most doctors don't routinely test their patients for HIV. I test all my patients for HIV and Hep C, for example, and that's something that needs to be part of our guidelines for PCPs, but specialists such as myself, to ensure that patients get tested for infectious diseases at least once a year and they get routinely screened. In addition to that, to have plans to have therapeutics available to them, and to support communities that have high infection rates. So, we need to really do a better job at controlling infectious diseases in our community.
I mean, those are five amazing points, and hopefully, Biden's task force tackles all of those. Mm-hmm. The other, I think, big problem here is state versus national guidelines. Mm-hmm. In your opinion, do you think that we need national guidelines and a unified front, or do we leave it up to each state, because the surges are different in each state? People have different opinions on the overall management of this. Mm-hmm. What are your feelings on national versus regional guidelines?
So, federalism is a huge issue within the U.S., right? A lot of states are very big on their autonomy and states' rights. And so, our Constitution codifies that. So the federal government only has so much power. And so that's important. But we already have in place guidelines, and guidelines are just that. They're just kind of suggestions and recommendations, really, on how to go about managing diseases. But in terms of things like a national mandate, again, the federal government can't enforce the national mandate, mask mandate on the states. And so they have to figure out different ways to do that. And what they've done in the past is use kind of a carrot policy, where they offer a lot of money for certain policies that they want to enforce. So, for example, for Medicare, Medicare has guidelines or protocols, or I don't know. They have, I guess, guidelines, and the way they enforce it is through the purse string. And so if certain hospitals or states don't enforce that, they don't get the money. And money is a very effective tool. So the Biden administration could think about doing that. Now, my concern with mask mandates is that when they do enforce these quote unquote mandates, they tend to enforce them on communities of color and poor communities. Those are folks that are always, getting cited, fined, and going to jail. So I'm always concerned when I hear mandates and enforcement, and I just want to make sure that anytime we have something like that in place, that it's done equitably and not in a way that disproportionately affects communities of color and poor communities, and should be progressive and not regressive. So that's always going to be, there's always going to be a tension between the U.S., the federal government, and the states. But if you have clear, consistent, uniform messaging and guidelines, and then speak with the governors, and the governors can then speak to their local mayors and leaders of the different municipalities, then there could be a coordinated strategy. The issue is that we don't have a unified healthcare system, and that's a huge issue because again, the federalism issue there, and we don't have a single payer system, and so on and so forth. So you have a lot of different healthcare systems within the country, and it's very fragmented. And so we definitely need to figure out a way to integrate the system so that they can communicate with one another. And that would be a huge undertaking, as you know. I mean, look at our electronic medical records, for example. It's pretty insane that a patient could come into your office and they could have a ton of information out there, but you really have no access to it. Medicare has instituted some pilot programs, one of which I'm part of, where physicians can be able to look at all of the encounters and the claims on patients so that you can get an idea of what care has been provided for that patient. But that's only for the Medicare population. And so that's a huge issue.
You know, you actually brought up a great point about the media, and I think that the media has certainly not helped this situation at all. And you've done a bunch of interviews on MSNBC, and you know, it really depends on what channel you turn on, but there's literally 1,000 messages about this pandemic, and they're all different. And I think that has played a critical role in people picking sides, people deciding what's mandatory, what's good for you, what's not good for you. How important is a unified, transparent media message during a pandemic? And is it even possible? I mean, there's so many channels out there, so many different networks with so many different ulterior motives. It makes it very difficult for the public.
So I agree. Yeah, 100%. I mean, I'm very, very American in that I'm very big on freedom, liberty, and autonomy, and not having any government telling me what to think and what to do, and telling private businesses what to do. So in terms of forcing stations to communicate certain messaging, I'm just not going to go for that. But there's other ways to circumvent that. One is to, again, be consistent in the messaging that's coming from the federal and state governments, but also to possibly create an additional network of some sort where the federal government can basically say, this is our message, and not let it be filtered through the different media outlets, because unfortunately we get a lot of our news from really biased really biased stations. So, MSNBC, CNN, Fox, they're biased as shit. You know what I mean? And they all have an agenda. And they all try to think that they're, the authority, and that their message is pure, and it's not. And so you have to, have a different media presence in place where folks can say, you know what, if I want to know what the government's saying, let me go here. Because by the time it gets filtered through the New York Times or Fox News or MSNBC, it's a whole different message. And so my suggestion would be to create a separate station where they can communicate directly with the public.
Yeah, I mean, I think that's honestly like half of the battle, is that you turn on the TV and the same facts can have two different messages, and that just makes no sense at all.
Yeah, definitely.
People talk about the number of cases skyrocketing, and that's obviously very alarming. But explain why, if the numbers are going up but the hospitalizations are okay, that's actually probably a good thing, because that's just going to be herd immunity. Can you just kind of go through that a little bit with the layperson who maybe is just following straight numbers? And the straight numbers might be going up, but the hospitalizations in certain areas may not be going up as rapidly. And that's actually a good thing, because you're creating immunity.
Well, yeah, I don't know about that. I mean, there's quite a few caveats there. One being that hospitalizations and deaths usually follow the spike in infections by a few weeks, even a month at times. So you have to take that into consideration. Florida, for example, DeSantis, Florida man himself, bragged about the rise in infections over the summer, saying that it's mainly amongst younger individuals who are not vulnerable, and hence we didn't have the hospitalizations. And folks like me were screaming, saying it's only a matter of time. Like you're sending the wrong message at the wrong time, and lo and behold, Florida became the epicenter a few weeks later. And so it's only a matter of time before these lower risk populations interact with the higher risk populations. At the end of the day, you need to decrease community spread. And the concept of herd immunity is really a terrible one, actually, if you're trying to control this pandemic. Yes, it is better if the younger folks get it and they don't come in contact with the vulnerable population, and they could kind of create a wall around these folks. But that's not what happens. That's not how we interact. Our behavior, in theory, is very different from our behavior in reality. And so the concept of herd immunity is not one that works. I mean, the UK tried it and they failed and they reversed course. You look at Sweden, they tried it, and relative to the other Scandinavian countries, they've done dismal. They were pretty dismal in that regard. And so I would never be an advocate of that. And just to kind of elaborate on herd immunity, it's a concept of enough people having immunity to a particular pathogen so that the vulnerable population will not be infected with it. That's kind of what we do with vaccinations right now, in that the infants and young babies don't have an immune system that's fully developed yet. And so because most folks are vaccinated against things like polio and measles and mumps and rubella, we protect our infants in that regard. But that concept doesn't really apply to the COVID-19 pandemic because it is a novel virus. There's a lot that we don't know, and it's important that we prevent the transmission of the virus and not just focus on folks getting the virus and then becoming immune, because that has been failed, and it's being promoted by folks who have a clear agenda and a huge bias. And we practice evidence-based medicine, and the data has to back you up. And a lot of folks that have promoted things like herd immunity, among other things, have been proven wrong. And when they've been proven wrong, you don't hear anything from them. They just move on to the next thing. You have to hold people accountable for the bullshit that they say. And right now, there's no accountability whatsoever. And I can just go back to one example where you have a lot of folks on social media saying Black folks are immune to COVID-19. That was complete bullshit. But a lot of people who I thought were respectable, a lot of folks who I thought were smart or educated, promoted that concept to the detriment of our community. And as you can see, we account for a large portion of the deaths, and that's a tragedy. People are literally dying because of this misinformation and also disinformation.
Yeah, I mean, I didn't hear that comment, but that's just ludicrous that someone would say that the African American population is somehow immune to this disease. But that's just an example of the crap that you hear on the media, and how if you don't know any better, you could believe it. You had mentioned before about a potential lockdown. Just discuss, in your opinion, how you balance the physical harm of the virus, hospitalizations, deaths, versus the harm of a lockdown, meaning financial, psychological, emotional, because it really puts a big strain. There's more use of drugs, there's more divorces, there's more suicides, more domestic violence. How do you balance those two? It's obviously such a difficult balancing act.
Yes, I agree. I mean, and I mentioned before, lockdowns are terrible. Okay, there's all kinds of collateral damage that's done. I mean, keeping kids from going to school is terrible, and so lockdowns are a blunt instrument. That's not something that you want to do. You need to avoid lockdowns, and so what I meant by that is that we're going to be forced into lockdowns. Now, like there's this false dichotomy where it's like either you lock down or you don't. Nah, like do your fucking job, okay? Meaning that, control the virus so we don't have to have lockdowns. When hospitals are getting overwhelmed and people are getting turned away, you can't just let people die, right? Yeah, you just can't. And so you're only forced with one option, the blunt tool. What I've said before over and over again is institute mitigation strategies so that we don't have to get to that point. But what Florida man did, DeSantis and his homie, his sensei Trump has done is pretty much abdicated their responsibility. And they're not doing aggressive, proactive measures so that we don't have to affect our businesses. I mean, the lower the transmission rate, the more likely you're able to do targeted approaches where, for example, if you do have a surge, you could target that community without a lockdown and just ramp up testing in that community, test everybody in that community, and then have those folks isolate rather than resort to these lockdowns. Nobody wants lockdowns, okay? And basically what's going on now with the current surge is that we're going to be forced into lockdowns. And it pisses me off. So when I mention that, people will get mad at me like, oh, you want lockdown to hurt the community? Nah, bro, I don't want lockdowns. Okay. I want to avoid lockdowns. Tell these clowns, I'm sorry. That's a little bit disrespectful, but tell these dudes to do their job, protect our community, and take the necessary measures. And one of the things that we haven't done is instituted aggressive testing. Our testing capacity is trash, but they will go out, and they have gone out and said our testing capacity is impeccable. Nah, bullshit. It's just bullshit. Just do your job, stop playing politics, and do your fucking job. I'm sorry. You know what I mean?
I love the way you keep it real. I'm going to have you on every single week, just letting you know. This is like the most refreshing interview. It's fantastic. And I think everyone agrees that, if people just stuck to the science and the data, and it wasn't politically motivated or someone else's ulterior motive, it would be so much easier. And, we are running out of time. I just wanted to ask you, this virus has ravaged pretty much every industrialized country, except for like New Zealand that has the advantage of being an island. And can we do better than the rest of Europe and South America under Biden's leadership? Do you really think that we can be different with correct leadership compared to other industrialized nations?
The easy answer is yes. I mean, Trump has done a terrible job at managing this pandemic. I mean, this was the biggest challenge to his presidency, okay? And he basically abdicated his role as a leader, and he's focused on, issues that were politics when he should have been, trying to unify the country and putting in place programs and mitigation measures so that we don't have this unchecked community transmission. So I think, anybody, I mean, I think I did, but I know I made a post that said a blind monkey could do better at this point. And so, yes, Biden can do better. I'm not impressed by Biden at all. I mean, I think Biden's, pretty mediocre as a leader. But compared to Trump, in terms of managing the pandemic, I think he's going to do a much better job because he's taking it seriously. He's put it front and center, and he's correct. Our economy can't fully open and thrive until we get this virus under control. And Trump has created this, again, false dichotomy between the economy or controlling the virus. And that's just not cool. I mean, I think in a way he's devaluing vulnerable populations. There's a lot of folks who are elderly, a lot of folks who are vulnerable, who don't have access to the kind of care that he got access to when he got sick, who are going to die when they get the virus. And their lives mean just as much as any other American. And so, the fact that Biden is making this front and center as the primary issue coming into his presidency, I think is a huge shift from Trump's management of it. And one thing that Trump did do well was Operation Warp Speed with the removal of the red tape and acceleration of the vaccine. But he's done a poor job in the messaging, and because the messaging was so dismal, a lot of folks have lost trust in the vaccines, and they're not going to get it. So it really takes a comprehensive approach that looks forward and informs the American public so that we can prepare, adequately.
Well, listen, Bernard, it's been over half an hour, man. I think I speak for everyone on here when I say that was an awesome interview. And we all appreciate just your candor, no bullshit. Let's keep it real. So I appreciate it, man. I hope you have a great rest of the day. Really appreciate all your knowledge, and we're definitely going to have you back on.
Ricardo, I appreciate you, man. And keep doing what you're doing. Peace.
I'll see you later, man. Take it easy.